All right, can you see me?
Yeah.
All righty, we're gonna roll. All right, guys, I think we're gonna get started here. Welcome back, everybody. We are at the conclusion of our 10-part CE lecture webinar series on Zoom. Tonight's session is called The Oxygen Advantage, the Healing Power of Proper Breathing. I'll introduce our speaker in just a second. But first, I want to thank our speakers last time, who it was Dr. Joanna Green, of course, Lauren, who's our speaker tonight, and then Leah Heckman, speech language pathologist. So I think it was a great 2-hour lecture. I hope a lot of people got a lot out of it. We got a lot of great feedback through email, and people stayed on and had some great questions. So really exciting to kind of talk about that topic since it's such a hot topic today. So I had a lot of fun doing that, and we look forward to hosting more of those, especially about tongue ties in the future. So if anybody wants to go back and watch any of our previously recorded webinars, you can do that on either our Facebook page or our YouTube page. So if anybody's not subscribed and following us on social media, please do so, because after this lecture series is over, we're going to announce some new kind of updates. And of course, we like to keep the content fresh, coming right out of the clinic. So feel free to follow along and join in on the fun that we get to have. So just as a quick thank you to everybody who took time out of their days, out of their nights to be a part of these Zoom webinars. I think it was a great success. The goal here, the vision for me, was to put on a 10-part lecture series that I felt was very whole health centered. And so I think we had some really great lecturers, you know, from nutrition to cardiologists. We learned about cardiovascular disease. We learned about stress elimination through exercise. We had the great Dr. Mariana Evans talking about, you know, early expansion in the pediatric population. You know, you name it. I think we covered it when it comes to the airway field and the overall kind of wellness field. But we're looking to build off of this, and we're looking to not be done. And so, you know, stay tuned. Like I said, we're going to announce kind of the next series of lectures. We're going to announce some really exciting ones that I think we have coming up. I've been working on putting together some guest speakers that'll be coming on to give you guys a lot of great content. So if you've enjoyed up to this point, I want to just say thank you for taking the time, and you know, we look forward to continued learning for a long time. So without further ado, I'm going to just kind of introduce our speaker tonight. So if you guys have heard me speak at all, Lauren finds her way in just about every single one of my presentations, because she's such a big part of what I do at the clinic daily. Like I said before, Lauren was a hygienist with me over in my general dental practice. And, you know, we started this journey together. We started this journey looking forward to adding a new additional service within our general practice. And little did we know, a few years later, we would be specializing. We would be out here in our own center, you know, doing amazing things. And we would give up the world of general dentistry, and we would give up the world of scaling teeth and, you know, being a part of that whole thing. So it's actually a quick little funny story. My best friend in the whole entire world came in today. He called me today and he said, "Hey, can I stop by the office? I think I got something in between my tooth." And I said, "Yeah, come on in. Lauren will see you." So I went and grabbed Lauren. She was training a couple of people on myofunctional therapy. And I grabbed Lauren. I said, "Hey, Lauren, Jason's going to stop by. He thinks he has something in his teeth. I bet it's just tartar or something, but, you know, can you get out your scalers and just try and, you know, see if you can find out what's going on and get rid of it?" And she's like, "Scalers?" She's like, "I don't even know if I have scalers over here." And then I said, "Well, you better find those scalers." And she said, "Well, even if I find them, I don't even know if I'm gonna remember how to scale teeth." So we joked for a second, and she got right back in the saddle and scaled those teeth up for my buddy. So just kind of a funny to think kind of how far we've come over the last few years, and kind of the things we're doing today, and the roots of where we started. So I'm not going to go on, because I could go on and talk about Lauren and all her services forever. Lauren is our myofunctional therapist. She is also our licensed Buteyko breathing practitioner. I got to update your slide here, Lauren. But I'm looking forward to her talk tonight. I know she's got a lot of great information, a lot of things that a lot of people don't think about. And so hopefully this is one of the more eye-opening lectures that you guys will hear on the whole CE series. So sit back, relax, and let's hear from Lauren. So Lauren, without any more rambling by me, I'm going to turn it over to you, make you host. Give me just a second as I pull up here. Alrighty, you got it?
Yep. Can you see that?
Yeah, sure can.
All right, awesome.
Perfect.
So good evening, everyone. My name is Lauren. I work at the Pain and Sleep Therapy Center located in Delaware, where we specialize in TMJ dysfunctions and sleep breathing disorders in adults and children. So as Dr. Robinson said, I was a dental hygienist for 15 years prior to becoming an oral facial myofunctional therapist and a licensed Buteyko practitioner. So tonight I'm going to be talking about all things breathing, discussing how we should be breathing, why it matters, what is functional breathing, what is abnormal breathing, and the Buteyko breathing method. So breathing is so essential to life, but it is often overlooked as a necessity for good health. So did you know your breathing pattern can affect your body and functions in a bunch of different ways? So without even knowing it, you may be messing up your sleep, your mood, your digestion, your heart, nervous system, brain, muscles, and the development of your teeth and facial structures just by the way you are breathing. However, if you learn to breathe correctly, you will notice an increase in energy, improved sleep, decreased anxiety, and overall better health. So, nasal breathing or mouth breathing, how should we breathe? I'm actually going to play a video where people were asked this very question, so I want you to pay close attention to the responses.
We've all done both, taking a breath through our mouth and taking a breath through our nose. But which is better for you? What do you think?
Better to breathe through your nose. If you work out, I believe it's better to breathe through your nose so you can get more oxygen.
I think it's better to breathe through your mouth because you can take a deeper breath.
Probably a combination, but I would go with nose because it's not going to dry out your mouth.
It's better to breathe in through your nose and out through your mouth. It has to do with the nose filtering the air.
So what's the real answer? Let's find out.
It is better to breathe through your nose, mainly because the nasal passage works as a natural humidifier. So you're breathing in humidified air, which you're not through the mouth, and then it also, creates a natural barrier for any particulates that you may be breathing in.
There you have it. If you have a medical question, you've always wondered.
So as you can see, some people think breathing should be through the mouth, some people think through the nose, and some people think you should inhale through the mouth, the nose, and exhale through the mouth. And then while some people think we should just be deep breathing. So just take a deep breath. What does this mean to you? So I think many people correlate a deep breath as being this where we breathe that way. And as you can see, my shoulders were rising, my chest was being activated, and my mouth was open. So we kind of hear this phrase of breathing everywhere. If you turn on the news during COVID-19, the first thing you'll hear with everyone being stressed out is just take a deep breath. Or maybe you may have heard take a deep breath from someone when you were stressed out. And so maybe even if you attended a yoga class that you were taught deep breathing. So take modern Western yoga, for example, which is known to often trigger and promote that overbreathing, which is that mouth breathing. And this type of breathing can be harmful for some people with certain medical conditions. So the Buteyko breathing research actually shows this. And ancient yoga teachers, they always considered the principles of proper breathing to include the nose for breathing during inhalation and exhalation. Chest breathing was never promoted, and neither is taking deep breaths. So unlike what many modern yoga instructors advise. So the Buteyko breathing technique is far more similar and aligned with ancient yoga breathing techniques than our modern Western yoga breathing. So there's actually a book that was recently published. It's called Restoring Prana, and it was written by Robin Rothenberg, and she was a yoga instructor, and she did very extensive research. And through her extensive research, she established that as with Dr. Buteyko's breath retraining technique, ancient yogis actually prescribed breathing less and not more. So it's actually a great book, so I really highly recommend it. So we've been taught to believe that deep breathing is optimal because it allows the most oxygen to the lungs. And as strange as it may seem, oxygen deficiency is not caused from a lack of oxygen, but rather a lack of CO2. So CO2 is not just a waste product. We need to hold on to a certain amount of that CO2 in the blood. So an important role of retaining enough CO2 is known as the BOHR effect. So I'm going to kind of keep it really simple here with this, but we all have a protein in our red blood cells, and above that red blood cell, it kind of looks like a red frisbee. And that is called hemoglobin, which delivers oxygen. So the condition in the blood needs to be optimal so the hemoglobin can actually release the oxygen to the muscles, the heart, the brain. If the oxygen actually stays stuck in that hemoglobin, you're unable to release the oxygen from your cells, which means they can't produce the energy or function properly. So when the CO2 levels are higher in the blood, the hemoglobin releases the oxygen. So that's what we want. But when the CO2 levels are lower from that overbreathing, that mouth breathing, less oxygen is released. So only by slowing down the breathing do we get that increased oxygen saturation. So what is functional breathing? So functional breathing is nasal breathing, and we should be breathing through the nose during the day and at night. When we breathe through the nose, we are getting a warm, moist, filtered air. We're also getting the benefits of nitric oxide. So nitric oxide regulates the blood pressure, it reduces cholesterol, and it supports a strong immune system. And it also is lowering the inflammation in the body. And when we are nasal breathing, our body is in a parasympathetic state. So that's that rest and digest state. And when we're breathing through the nose, the breath is going to be soft. It's going to be slow. It's going to be smooth. It's going to be effortless. You're going to be unable to hear yourself breathing. And then, of course, the more you use the nose, the easier it is to breathe. So I know this sounds like any time we're breathing through the mouth, the nose actually gets more congested. So it's kind of like a vicious cycle that goes around and around like on a merry-go-round. So we kind of have to break that cycle. And then nasal breathing equals diaphragmatic breathing. So I'm going to show a video here that kind of demonstrates how the diaphragmatic muscle works. But before I apply it, I want everyone to kind of take their hands and place them on the outside of your ribs and really paying attention, as you're breathing in with this video, feeling the ribs expand outward. And as you breathe out, feel the ribs moving inward.
The primary muscle of respiration is the diaphragm. The diaphragm is a thin, dome-shaped layer of muscle and tendon that separates the abdominal cavity from the chest cavity. It gains its shape from its attachments and from the organs that surround it, especially the heart, lungs, and liver. The diaphragm attaches at the costals along the lower rib cage, high in the front at the sternum, and deeply in the back along the spine. The diaphragm also attaches to itself via a central tendon, making the diaphragm one of the unique muscles of the body. The diaphragm uses its central tendon and its attachments as leverage to flatten during inhalation. The expansion of the ribs comes from the resistance of the internal organs to downward movement. As the internal organs are slow to move, the ribs expand to make room for the lungs. While the diaphragm attaches at the bottom of the ribs, its range of motion never reaches that low in the body. As seen from below, we get a sense of the full range of motion of the diaphragm as it would glide over the aorta, the vena cava, the esophagus, and the internal organs. For more information, visit www.
So one thing to point out, with that diaphragmatic muscle, as we're moving inward and outward, it also massages the intestines that aid with digestion. So people who are breathing improperly through the mouth, they're going to be swallowing more air. So they're also going to experience a little bit more digestive issues. So abnormal breathing is actually the reverse of that functional breathing. So that is that mouth breathing. And when we're breathing through the mouth, we're activating the upper chest. It's also kind of known as that overbreather as well. And when we're breathing through the mouth, we're breathing in dirty, unfiltered air. We're also not getting the benefits of that nitric oxide. And we're also not getting that oxygen delivery that we want as well. And our body is in that sympathetic state. So that's that fight or flight state. So typically with abnormal breathing, there may be excessive sighing and yawning. The breath might be fast or deep breathing. unable to catch breath with exercise. So even walking up a flight of stairs, you may be quickly out of breath. And then able to hear themselves breathing or others can. So that's kind of like that audible breathing, that resistance breathing. So if you've ever heard anyone that kind of is breathing and you can hear the congestion in the nose as well. And then feeling you aren't getting enough air. So most of us are over breathers and we're not even aware of it. So we come into the world breathing correctly with that belly breathing. And then a host of challenges kind of go against our breathing. And they could be such as like prolonged sitting, slouching, poor posture, looking down at our phones, at computers all day. And it's important when we're retraining the breathing, we want to have good posture. We want the shoulders back. We want to have the ears aligned with the shoulders. And then of course, other challenges that go against our breathing include like poor sleep and stress, poor diet, lack of exercise, resistive clothing. One thing to note on that is I feel like a lot of women that I work with tend to go their whole lives holding their stomach in. So that is kind of a challenge that goes against that breathing as well. And then bad habits, smoking, pollution. So overbreathing is also known as hyperventilation, and hyperventilation is a normal stress response, but you don't want it to be done day in and day out. So when we are overbreathing, it causes our airways to narrow. It reduces the oxygen delivery and blood flow to the heart, as well as throws off the pH in the body. So how can we optimize our breathing? So really by breathing retraining, such as the Buteyko breathing method. So with breathing retraining, you can see improvements not only in your heart rate and your blood pressure and your circulation, your sleep, your digestion, hormone secretion, energy, but overall health. So truly, who doesn't want this? So what exactly is Buteyko breathing? So Buteyko breathing is a series of exercises, and it's aimed at developing healthy breathing patterns in adults and children. So it really normalizes the breathing pattern. And it's promoting that nasal breathing, that relaxation, that diaphragmatic breathing. So getting that breath down to the diaphragm while also increasing the oxygen saturation. And the goal is we really want to have that correct ratio of both carbon dioxide and oxygen in the bloodstream. So that BOHR effect that I was talking about earlier. So the Buteyko breathing method was actually founded by Dr. Buteyko, so hence the name. He actually worked at a medical training. He did medical training in Russia. And there he worked at a medical institution where with his practices, he kind of was monitoring the breathing of terminally ill patients prior to death. And after hundreds of hours spent observing and recording their breathing patterns, he was able to predict with accuracy up to the minute the time of death of each patient, which I think is crazy. And through that, he also observed how each patient's breathing increased as their condition worsened and as they approached death. So he actually himself as well was diagnosed with malignant hypertension, which is a fatal form of blood pressure in the 1950s. And he was given 12 months to live. So he did a lot of research on his illness in depth, but realized there was not much he could do. So he began wondering if the reason his condition was going from bad to worse was due to his deep breathing. So he kind of noticed that when he slowed down his breathing, his symptoms went away. But then when he increased his breathing, his symptoms came back. So he actually went on to live till 2003. And then I also had the pleasure to train with Patrick McEwen, who he himself was trained with Dr. Buteyko. And Patrick suffered from like chronic asthma since he was a kid and was on several medications, steroids, the inhalers. And by retraining and slowing down his breathing, he was able to actually cure his asthma. So to this day, he is no longer on asthma medication. And then the Buteyko breathing method in the 1990s, it left Russia and arrived to Australia and the UK, and then eventually to the United States. So who does the Buteyko breathing method benefit? So it benefits people who have asthma. So the Buteyko breathing method was actually founded on helping people with asthma. It also helps people with rhinitis, which is that nasal congestion. So that's that inflammation of the nose. So if we slow down the breathing and we're using the nose for breathing, it reduces that soft tissue inflammation in the nose. And the more we breathe through the mouth, actually the more congested the nose gets. So it's like that vicious cycle I was talking about earlier. And then of course it helps with people who have hay fever. And then it also helps with neurological, so anxiety, stress, and panic attacks. So anytime we're anxious, we're going to breathe more heavily, and that is going to come from the chest. And then it helps with people who with circulatory, so hypertension. When we use the nose for breathing, as I talked about earlier, we get the nitric oxide. So nitric oxide, it is regulating the blood pressure, the blood flow. It reduces the cholesterol, and it also helps to reverse the buildup of plaque in the blood vessels. So when we slow the breathing down, we really get the full benefits of that nitric oxide. And then, of course, it helps with people with sleep disorder breathing. So like insomnia. Insomnia is a risk factor for sleep apnea. So it truly is that drive to stay awake because the brain knows something bad happens when you fall asleep. And then snoring itself can actually cause plaque in the arteries. And it is a sound of poor breathing patterns. And then, of course, with sleep apnea, whenever we decrease the rate of air coming in, there is less susceptibility for the airway to collapse or to create that vibrate noise. So that vibrate noise is actually the snoring that happens before the collapse of the airway. And then, of course, it also helps with people with childhood development, which I'm going to get into in the next slide, but also to mention about ADD, ADHD. After a night spent breathing heavily through the mouth, a child is going to wake up exhausted. It's going to cause poor concentration, focus in school, frustration at school, which over time can lead to that diagnosis of ADD and ADHD. So the first advice I always give parents who have with kids who come in and who are diagnosed with having ADD or ADHD is to really check their sleep habits. So, is the mouth open? Are they a restless sleeper? Are they snoring? All of these signs are that the child is breathing through the mouth. So there is a link to sleep disordered breathing with people who have ADD or ADHD. So for childhood development, it is crucial as we're growing, as we're developing, is that we want the lips to be closed. Lips are nature's braces. We want the tongue resting at the roof of the mouth. That is nature's palatal expander. If the tongue is resting at the roof of the mouth, it's going to cause the arches to develop to be nice and wide. The teeth are going to come in straight, and ultimately, the airway is going to develop wide as well. So thus allowing the tongue not to fall back into the airway with less risk of sleep apnea in the future. So you don't grow into it. It doesn't happen overnight. You actually grow into it. So if that tongue is up, it's going to create a tense, strong airway. And then, of course, if the tongue is resting down low, everything is going to form to be really narrow. The teeth are going to be crowded. We're going to see that high palatal vault that's impinging on the nasal cavity. So, of course, the roof of the palate there is the floor of the nasal cavity. So, and then, of course, the airway is going to develop to be narrow as well. So I'm going to play this here, which is kind of talking about the flow of air coming in. With sleep disordered breathing.
Obstructive sleep apnea occurs when the upper airways collapse, resulting in holding of the breath during sleep. After a period of time, the sleeper partially wakes up, gasping for air. This cycle of breath holding followed by gasping can occur many times an hour during sleep. In addressing obstructive sleep apnea, two factors need to be considered. The first is airway size, and the second is the amount of air that we habitually breathe. In relation to airway size, the narrower the upper airway, the greater the negative pressure as air is drawn into the lungs. Habitual mouth breathing during childhood can alter the shape of the face, resulting in small or receding jaws. This reduces airway size and increases the risk of lifelong sleep apnea. As we get older, loss of muscle tone in the upper airway also contributes to holding of the breath during sleep. To help open the upper airway, it is important not to sleep on the back and also to breathe through the nose. The second consideration in obstructive sleep apnea is the amount of air that we breathe. It is very common for people to habitually breathe too much air, as indicated by audible breathing, often through the mouth. Heavy breathing during sleep increases negative pressure in the upper airways, causing collapse. Imagine inhaling a large volume of air through a collapsible paper straw. The heavier one breathes, the greater the likelihood of the walls of the straw collapsing inwards. On the other hand, breathing light through the straw causes less negative pressure, thereby reducing the risk of collapsing the walls. Breathing re-education to reset the breathing center in the brain to a lighter breathing volume significantly reduces the occurrence of obstructive sleep apnea. Combining this with myofunctional therapy to strengthen the upper airways enhances the benefits, resulting in a significant reduction in apneas and hypopneas. Obstructive sleep.
Okay, so breathing too intensely, often through the mouth, can result in sleep disordered symptoms. So such as that snoring, the sleep apnea, disrupted sleep, even nighttime asthma symptoms, which are usually common between 3 and 5 a.m. Then needing to use the bathroom during the night, fatigue first thing in the morning, dry mouth, also like a bad breath in the morning. Symptoms upon awakening could also be like wheezing or coughing, breathlessness, or a black nose. So the mouth breathing during sleep is going to lead to a larger breathing volume as too much air is drawn into the lungs, and then that overbreathing is going to cause the airways to cool, dry out. It leads to that inflammation and then further narrowing of the airways. So a mouth tape. So in conjunction with breathing retaining, I recommend mouth tape to almost all of my patients. If a patient can nasal breathe for 1 minute, they can do it for life. So what is mouth taping? So mouth taping is just what it sounds like. It is taping the mouth shut. And most people are alarmed by the idea of taping the mouth shut at nighttime, but mouth tape forces you to breathe out of the nose. So it is facilitating that nasal breathing. So is mouth taping safe? Yes, it is safe. For those that don't feel comfortable with mouth taping, I typically encourage taping like during the day first, starting off in increments of time, and then kind of increasing that to an hour, and kind of just working up to that until they feel comfortable enough to do it at nighttime. And also during the day, you could kind of start off doing it more vertical with the tape and then eventually going horizontal. So if you're waking up every morning without the tape on your mouth, it is truly a good diagnostic tool to kind of recognize how frequently that mouth breathing is occurring. So at that point, you really need to kind of look into why your body is resorting to that mouth breathing. So common culprits could be a deviated septum, allergies, large adenoids and tonsils, or other airway issues that may require you to need like a mandibular advancement appliance or a CPAP machine. Mouth tape. So as far as how does taping my mouth shut improve the quality of your sleep, mouth tape helps improve the quality of the sleep by increasing the oxygen in the nitric oxide, which is what we want. So nitric oxide, as I talked about before, all the amazing benefits of it, but it improves the blood pressure and the cholesterol, the heart function, the cognitive function, immunity, inflammation, weight loss, digestion, athletic performance. So truly, it also helps with achieving a deeper sleep. So now I'm going to kind of get into some of the Buteyko exercises. And with this one, decongest the nose. This is actually Dr. Robinson's probably favorite exercise. And it's great for those suffering with nasal congestion, stuffiness in the nose, and overall allergies. So typically I recommend doing this right before bedtime, or truly anytime you have that feeling of congestion. So even if you were to have, like, you go to bed and you wake up in the morning and you feel congested, maybe you had dairy, and for some people that can cause that congestion in the nose, this is a great exercise to do. So before I get started, I want to make sure that if you're doing this exercise along, I want to make sure that you are having your lips closed, and we want the tongue resting at the roof of the mouth. So for all dental professionals who are on here and you know where the incisive papilla is, that is where the tip of the tongue should be resting. For those of you on here that don't know what that is, I want you to take your tongue. I want you to kind of wiggle it back and forth behind the front teeth. And you should feel speed bump there. And that's where the tip of the tongue should be resting. So never pushing against the teeth. So I want you to keep that tongue up and lips closed. You're going to maintain feet flat on the floor. Shoulders are going to be back. And imagining a string pulling you from the crown of your head. So you're going to take a normal breath in through the nose and then a breath out through the nose. On the exhale, you're going to pinch your nose, and you are going to, as you're pinching and holding your nose, you're going to gently sway that body side to side or nod the head up and down. And as you're doing that, you are holding until you have a strong desire to breathe. So when that strong desire to breathe sets in, you're going to let go of the nose. You're going to still the body, and you're just going to continue to nasal breathe in and out of the nose with keeping those lips closed. So one thing to note on this is typically after doing any kind of these breath holds, I typically tell people you want the first breath after the hold to be an inhale, because we're building up all this awesome stuff in the nose and we want to maintain that nitric oxide. So typically with this exercise, I recommend performing this at least 6 times before bedtime, with a resting period of 30 to 60 seconds in between. So another exercise that I typically do, which is a reduced volume breathing exercise, and this is great for those suffering with sleep apnea. So again, with this exercise, posture is always important. We always want shoulders back. We want to imagine that string kind of pulling you from the crown of your head. Feet are going to be flat on the floor. So with this exercise, you can also, not only doing it sitting upright, you can also do it lying down on the floor. Some of my patients, I'll even have them practicing it standing against a wall as well. And when you do this, you'll place one hand on your chest and one hand on your tummy, so right above your belly button. And you're going to take a soft, slow, gentle breath in through the nose. And really at that top of the breath, just allow a relaxed, slow, gentle breath out. So you're really focusing on the slightly colder air coming into the nose, that warmer air exiting the nose, concentrating on slowing down the breathing. So as you reduce and you slow down your breathing, you will feel a mild need for air. And this is normal. I want you to try to maintain this exercise for 4 minutes. So it should be distinct without being stressful, but if you feel stressed, then just allow your body to relax and just take a little more air with each breath. So this exercise is best practiced at least 4 to 5 minutes, and you can practice this up to 3 times a day. With a lot of my patients, especially with sleep apnea, we really focus on reduced volume breathing at nighttime before bed. And one other good thing, if you're doing this right now, is if you take one hand on your chest and one on your tummy, just kind of see what hand moves first. We want down in the tummy to move. We don't want the one on the chest here to move. So I love this quote, breathing is the first act of life and the last. Our very life depends on it. Since we cannot live without breathing, it is tragically deplorable to contemplate the millions and millions who have never mastered the art of correct breathing. So I don't know, I'm going to open it up now to any questions that anyone may have. And let me see here if Dr. Robinson is on here to come join me. Are you there?
Yeah, I'm here.
Okay, awesome. So I kind of got done a little early, I guess, but
yeah,
man.
man.
If there's anything you want to like add on anything or?
Yeah, I think we should take some questions. And
sure. Okay.
Yeah, let's see if anybody has any questions. So Jessica has a question for us.
Sure.
Do you suggest these exercises for children? What age group? I find kiddos have a hard time following directions.
Yeah, so I mean, these exercises are definitely good with kids, but I would say the one that I teach most with kids is more of like physical exercise versus like reduced volume breathing. I mean, I do hand on chest and tummy, but kids, I feel like, do well with more of like breath holds with kind of walking and having, say, like the parent stand at one end and having them inhale, exhale through the nose, and then they'll do like 10 steps, say to the parent. I feel like they do better with more of the physical than kind of sitting here and be like, okay, like put one hand on the chest, one on the tummy. I feel like they like more of the physical activity. So I would say yes to that question would be that.
Yeah. So let's elaborate on that a little bit, Lauren.
Yeah.
So as far as like the physical activities, like, so you do competitions in our office, like you see, you know, how far a kid can get by doing the pinch the nose and seeing how many laps he can get up and back. So I think, Jessica, making sure that it's a competition for a kid and making sure it's a challenge for a kid is always rewarding and is always gets kind of better results. So I can speak from personal experience. So my 4-year-old, who does not take the best directions in the world, and he's a little bit frustrating for me to work with. Lauren gets him to do a lot of things through rewards in the office, and he listens to her pretty well just because she kind of comes at it from, let me see if you can do this. Oh, you can't do that. Well, let me see if you can do this. And it's more of a challenging thing, I think. And I think that works pretty well for you, Lauren, right?
Yep. Yeah, I agree.
Yep. How early would you recommend a kid doing breathing exercises?
Oh gosh, like, I mean, I feel like it's never too early to start retraining to nasal breathing. I feel like, especially for me, with like, if you're noticing they are breathing through the mouth, I think it is good to start as early as you can to kind of make awareness of that. So I mean, I would say typically in the office, I mean, I see kids as young as 3. So I feel like I think, you know, 3 and older, but typically even by 5 and 6. So I feel like, you know, but definitely by 3, you can start kind of working on nasal breathing.
Yeah, that's what I was going to say too. I think
Yeah.
3 is the perfect age to start. So I would agree with you. All right. So if someone has lip incompetence, mentalis strain when fully closing the lips, will mouth taping train the lips to close more effortlessly and remain closed, especially when asleep? How long do you recommend taping to train nasal breathing habit? I'll say
Yeah.
that's so a myofunctional thing. You know what I
Yeah.
mean? I think that's where Lauren's myofunctional therapy background and breathing background comes in handy. So you can elaborate a little bit more on that, Lauren.
Yeah, I mean, definitely, I think for sure you're going to need to work on all of the oral facial muscles in conjunction. And I feel like whenever I recommend taping with my patients, we're kind of doing that in conjunction with myofunctional therapy, Buteyko breathing. So I would say definitely in conjunction with that. And as far as like how long for retraining to nasal breathing habit, it's typically 60 to 90 days to really retrain. And so typically with mouth tape, I mean, I've been doing mouth taping, I don't know about Dr. Robinson, but definitely over a year, if not longer. And I still do it. I do know that if I am flying, I mean, my husband's like, oh, you know, my lips are staying closed. So yes, 69 days for retraining, but you know, I have some patients that have been doing it for a long time, and I'm one of them, and I just feel like it's a security blanket for me. So I still do it.
Mm-hmm. Yeah, I would agree. I do the same thing. I have never considered myself a mouth breather. I always have been a obligatory nasal breather. But I tape my mouth shut every single night I go to bed. And I've just noticed way less congestion when I wake up in the morning. I've noticed way more of a deeper sleep. I don't have interruptions with my sleep anymore. So for me, the taping is like a necessity, I think, at this point. And I know Patrick McCune keeps saying it takes about 60 days, 90 days to retrain, but like, I don't know, it's not a big inconvenience. I would rather just ensure the fact that I'm breathing only nasally. So for me, it's kind of like a safety blanket, like Lauren said. So I prefer it over not. So if I'm ever away and I forgot my mouth tape, it's like not a good trip.
I freak out.
Yes, same with me. Same, exactly. So this is a good one. How to breathe during working out. So is it hard? It's hard for this person to breathe through the nose when they're running. So they typically mouth breathe. What would you say for that, Lauren? I can have a couple suggestions with the nose cones.
Yeah, I mean, I was just gonna say that about nose cones too. So I feel like opening up the valves too does make the flow of air, like you're able to get more through the nose, especially when you're running. So I know it may seem strange if you're going to the gym, and I personally, I don't go to the gym with my nose cones in. If I'm working out at home, I will wear them. I feel like it does make it easier for me to breathe. But one thing to note on mouth breathing, of course, mouth breathing is emergency breathing. So if you're doing a high intensity workout, at some point that mouth breathing is going to come into play because it is that emergency breathing. But as far as like kind of retraining that to do the nose breathing, I would say like the cones are great. Like they're called mutes. I think those are probably the best, even over a breathe right strip. But you could probably even try that too. And then of course, really retraining the breathing to kind of really focus on, even for 5 minutes or so, if you're, walking or running, trying to do that for increments of time, keeping that mouth shut and only breathing through the nose.
Mm-hmm.
And I don't know if you have anything you want to add on that.
No, I think absolutely you touched on that. So we have some other good questions. Really good question here. So do you have to pinch the nose on the breathing exercise, or can you just hold your breath while you rock back and forth?
Pinch the nose and the breathe. So you're going to take an inhale and exhale. On the exhale, that is when you pinch the nose. So you're holding the breath. And as you're holding the breath, you want to sway the body back and forth or nod the head up and down. So the whole time you're swaying and you are holding that breath as you're doing that until you have that strong desire to breathe. And then once that desire sets in, then you're going to let go of your nose, still the body, and then just continue to nasal breathe in and out through the nose.
Yeah, I agree. And I think more so the question was, do you have to pinch your nose, or can you just try and hold your breath? And
Oh, okay. I'm sorry.
Yeah.
Yes. So, I mean, yes, I guess you could hold your breath. I just find like pinching the nose, you're definitely guaranteeing that you're keeping the breath held. So I typically recommend with my patients pinching the nose, but I have had some patients, especially with having valve collapse, they find that when they pinch the nose, one of their nostrils may kind of stay stuck in. So it's kind of harder for it to come out, like to open back up. So I have had patients that have asked me if they could do that. It's just, I feel like it's more effective to keep the nose pinched with your fingers.
Yeah, I think you definitely have to block the nose. So for me, I have internal nasal valve collapse. So when I pinch my nose, it takes a minute for the collapse to basically come back open. So for me, if I just take my fingers and I just plug my nose, that's a good way to also ensure that there's no air exchange whatsoever. But great question. I think if you just are relying on holding your breath, you're still probably having some escape of some gases and having some exchange of some gases. I mean, as you know, from the virus that we have going on, you never really know when something's getting inside, your orifices, I should say, so I think ensuring that you pinch or block is probably the best way to perform that exercise. Lauren, can you tell us more about the taping? Is it used for kids or only adults? What are some indications and contraindications for kids?
Yeah, so I mean, it's used for kids and adults. I mean, I know you tape your son. I know Patrick, when I trained with him, I know he kind of recommended more towards like ages 6 with kids as far as taping. He recommended if taping kids, like kind of starting with tape across the upper lip and then along on the bottom of the lower lip, kind of to hold the lips together versus going straight across is kind of what we had learned. But I know Dr. Robinson, you tape Bryce. But I would say, of course, like we always do like a full workup on all of our patients. So, mouth taping for some people, yes, is recommended, and for some kids. And then for others, of course, if they have, obstructions in the airway, different things, even though we want to retrain that nasal breathing, sometimes we do have to get like an ENT or like other people involved in the process to kind of remove those obstructions. And then once, say, tonsils or adenoids are removed, then we really want to start to facilitate that nasal breathing and kind of break that habit. So I don't know. I mean, do you have anything too you want to kind of add for that, or?
Yeah, I mean, me in particular, I don't think it's
I know
ever.
you do, Bryce, and I know.
Yeah, can you unshare your screen real quick?
Oh yeah. Let me see.
So yeah, me in particular, I don't think it's ever too early to tape your kid's mouth shut. I would recommend it in a 3-year-old. I mean, we're trying to get my 2-year-old to tape her mouth shut right now, and that's just been a challenge. But I think the earlier you start, the better. But I think I wouldn't be as comfortable if I wasn't an airway expert. I wouldn't be as comfortable if I hadn't had my kids in for a CBCT and know that there's no major like obstacles, in their airway or in their nose. Now, with that being said, my kids both suffer from enlarged adenoids and tonsils, and so we're going to get those out with an ENT coming up here pretty soon. We were scheduled during COVID, but obviously got rescheduled. But with that, we've been trying to reduce a lot of the lymphatic tissue in the back of the nose and the nasopharynx and in the oropharynx in order to kind of get rid of that inflammation. And nasal breathing and mouth taping is a fantastic way to do that. Lauren, can you make me host again?
Oh yeah.
Okay. So how young do you start mouth taping? I think we just answered that. I'd say, Patrick McCune says 6 is a great time. You shouldn't be any later than 6. I would recommend more like a 3 or 4 is what I would recommend. And okay, so another question, Lauren. So do you start breathing exercises early on in therapy, or do you wait a few months for proper tongue and lip function? That's a great question for you.
Yeah, so I typically, normally how I do it is I work on especially like retraining the lips, getting the proper tongue posture, and then we kind of start working on breathing. So I would say I don't really start right away with breathing. We really work on strengthening the lips, getting them closed, working on proper tongue posture, and then we start to incorporate some breathing exercises. I'm trying to make you host here. I have the 3 up here, but I don't see an option for that.
You don't?
No.
So just hover over my picture. Click the 3 dots on my picture. And then go down and say make host. All right. Why is the reason for nodding your head while you're holding your breath? That's a good one as well.
Yeah, so I mean, of course, as we're doing that, that's increasing the blood flow, the oxygen as well. And sorry, I'm just trying to put this thing here. Yep. So yeah, as we're doing that, it's increasing our blood flow. It's increasing the oxygen to the brain. So I would say, and then of course, like we're getting that nitric oxide we're building up as well, which is great too. I don't know if Dr. Robinson, there's anything else you want to add to that, but I feel like that's kind of.
Yeah, I think you're trying to get the gases to move around, trying to make things more motile. So when you're holding your breath, you're changing the pressure inside your sinuses, inside your nose. And so by just moving back and forth and nodding back and forth or going up and down like this, you're just helping move those gases around a whole lot more efficiently. Do you see it, Lauren?
Yeah, you're just big and there's no thing to hover over you.
So go up to the top right and just go to like gallery view.
Okay, now I see it. Sorry.
Okay. Then go to the 3 dots and make me host. What kind of tape do you use when taping mouth shut? So for me, Kim, I like the Buteyko. I like the snoreless strips. You can get those on Amazon. You can get like a pack of like 100 for like $10. I typically use, they're just like these little strips that you peel off. When I do mine every night, I put the strip on the back of my hand. I peel it off once just so it's not too sticky, and then I apply it to my lips. And I typically will use mine. The one that I used last night was on its 3rd night. That's about as much as I can get out of them, is I use the same one for 3 nights in a row. Sometimes I only use it for 1 night in a row. It depends on the night. But I'd say typically I try and get about three nights out of each strip. Now, Lauren likes the 3M. She likes the 3M micropore tape. And I know she recommends that to a lot of her patients. I'm just a snoreless strips guy. My wife is a snoreless strips girl. Lauren's a 3M micropore, and I don't think it matters. I think you definitely want to get some sort of porous tape. I think you want to get a tape that's strong enough to try and stay on there, but not too strong. So those are the two that we
I think
recommend.
like one thing to note on that is that I find that most of my male patients with like facial hair do better with like the Buteyko tape or like Somnifix, like some one of those, where I feel like a lot of women they can keep the 3M paper tape on, or people who have sensitive skin, the 3M paper tape is great for. And I typically always recommend putting something on the lips too, especially for women. I feel like for men with the facial hair, it's a little different, but just to kind of moisten those lips out before you put that tape on too. So it's not coming off in the morning really tough.
Yeah, so here's my son. So if you look at him right here, he's on the right here with Grinch. So that's the Buteyko snoreless strips. So Grinch has a snoreless strip, and so does my son Bryce, as he's sleeping there. So that's kind of how it is. I cover up his lips. I don't want anything going into his mouth at nighttime. I want to make sure everything goes through his nose. So that's what I do. So any thoughts of breathing with an N95? Someone on a dental blog mentioned Buteyko breathing. That's a great question, Lindsay. Yeah, so what we found with all these people wearing masks is, number one, I think hopefully everybody's realizing they're having more awareness for the way that they breathe. A lot of mouth breathers, you can see the masks kind of coming in and coming out. A lot of people that are mouth breathing tend to get a little bit more lightheaded because of so much carbon dioxide exchange. So people kind of level off as they with the seniority of years that they have here on the earth, if that's the best way for me to put it. And so if you're used to breathing through your mouth for a really long time, then your body just kind of accommodates to that. Not that it's healthy, but your body accommodates to that. So now when you're taking that mask and you're not allowing that carbon dioxide to escape like it's used to, then you can become a little bit lightheaded and be cognitively kind of impaired. Now, for people like Lauren and I, we practice nasal breathing all day long. It's not really that big of a change. But I have been wearing the N95 mask, and I can say it's been a little bit troublesome to be able to, breathe normally. So I would say, yeah, just make sure you're breathing through your nose with the N95. Make sure you're not wearing it when you don't have to. So we're recommending, if you're not around people and you don't need to wear a mask, like take that off and get back to the proper oxygen exchange with the environment. Would you agree, Lauren?
Yeah, no, I would definitely agree with that. Yeah, I feel like even too, some of our patients that are coming in the office that have like glasses on and have their mask on, it's like, just from all that, it's like fogging up. So you can really tell how that breathing is with that on.
Yeah, even with the mask on, we can really tell if you're breathing through your mouth or not.
Yeah.
So Lauren and I are judging you right when you walk into our office. So another question, if you have sleep apnea and are using a CPAP machine, do you still recommend mouth taping? Yeah, if you wear nasal pillows, absolutely. Yeah, if you're wearing a CPAP machine and it's just the nasal pillows, 100% tape that mouth shut. That is like, you're going to get the best airflow you've ever gotten with that. I mean, a lot of CPAPs can actually be turned down a little bit. We see patients on CPAPs of like, 12 liters of oxygen flow, and we can turn that all the way down to like 4 or 6 if we can get that mouth tape going. So yeah, definitely it's a great indication is CPAP, wear mouth tape as well. I think people were typing in the chat box as well, Lauren. So let me take a peek over here. Have you seen children with ADHD that are able to do therapy, that are able to get off medications and improve their quality of life? My nephew struggles with school. Absolutely, Laura. Absolutely. That's like what we pride ourselves on, is getting these kids
Off of medicine.
Yeah. Go ahead, Lauren. You work with a lot of kids.
Yeah, I mean, that's the main thing is that, and I feel like a lot of parents who come in, I mean, a lot of people don't really know the correlation between ADD, ADHD, and like poor quality of sleep, like at nighttime, the correlation with that. So I would say most of my patients that are coming in, once I kind of address that with them, it's crazy because I feel like a lot of doctors that are prescribing that for kids, they're never checking what their sleep is like at night. So definitely, I have many patients that we've been able to, try to transition them from starting off with like, they're starting to wean down on like taking less of the medicine and noticing improvement, especially when we get the kids sleeping better. Mom, I have one family I can think of in particular has noticed a huge difference in their child's behavior just by improving his quality of sleep at night. So yes to that question for sure.
Yeah. So we have a couple of people. We have a couple of people commenting from Facebook, Lauren. They're not on the webinar, but they're commenting on Facebook.
Okay.
So somebody wants to know, will you see a decrease in the size of the turbinates once you start nasal breathing?
Yes. So, of course, like whenever we are retraining the breathing, we're slowing that breathing down. We are going to see a decrease in the soft tissue inflammation. So we're going to see a decrease in those turbinates. As far as changing bony structure in the nose, the breathing, we can't do that, but we can change that inflammation in the nose. So turbinates are for sure, by retraining that, you can see a reduction in that for sure.
Yeah, for sure. So somebody said, what's a nose cone? Let me see if I can pull up an image of a mute nasal cone. But so let's move on to the next question, Lauren, real quick. Could you give the title of the book you mentioned in the beginning of the course, Restoring?
Oh, yeah, it's Restoring Prana, and it's by Robin Rothensberg. I'll read that.
Awesome. Hey, Lauren, do you have, can you read the other ones for me?
Oh, read the other ones?
The other, are you on the Zoom chat?
I am, yeah. Let me see here. Okay. Myotape, where do you find that online? Myotape may be less stressful to put, someone mentioned myotape, less stressful to put on kids. Where can you find that? So there is a myotape. Yes, there is that, and you can find that online.
So, all right, next question. Do you make sure the patient is fully nose breathing before you start myofunctional therapy?
Fully, what was the question again? I'm sorry.
Yeah, do you make sure the patient is fully nasal breathing before you start myofunctional therapy?
No, I mean, I would say like most of my patients that are coming in are not nasal breathers. So I still start therapy on them, even if they aren't nasal breathing, because one of the goals of therapy is to help someone achieve nasal breathing. So yes, I mean, I'll start that. That's part of the goals that we're working towards.
Yeah, I agree. Can you see my screen?
Yes.
Can you see the mute nasal cone?
I think I wrote the wrong book there. Yes, I can see them.
Okay, so guys, here's what a mute nasal cone looks like. These are the ones that we recommend in our practice. And they're just like these little nasal dilators that you just putting inside your nose. And I mean, this is basically what it looks like. I mean, this is a great example of what it looks like. And I wear these when I run, and I wear these when I sleep. So running and sleeping are the two times where I have trouble breathing through my nose exclusively, or my nasal valve collapse can come into play. So this is what mute nasal cones do. All right, so.
Can you see the other questions or?
Yeah, if someone does not have a good upper nasal passage way, will they remove the tape while sleeping so they won't die? Yes. So
Yeah.
there's been no documented cases of anyone ever dying from mouth tape. We don't recommend duct tape. We recommend micropore tape or snoreless strip tapes. But the brain has really one vital main function, and that is to keep you breathing. So your mouth will open up and rip off the tape.
Yeah, it'll rip it off.
For some reason there's some sort of blockage. So there's never been any documented cases of death due to mouth taping.
And if anything, I feel like it's a great diagnostic tool to kind of see, if you can't keep it on, I mean, if it's constantly coming off, I mean, you need to figure out why you have to resort to that mouth breathing. Like there's something going on there.
Yep. How about a 10-month-old who keeps his mouth open during the day and the night? Do you recommend taping the mouth for babies? That baby needs to be, you need to figure out what's going on with that baby.
Yeah, and definitely not taping.
Yeah, something's going on. I wouldn't resort to taping. Taping is great for older kids, anyone with an airway evaluation. But it sounds like that 10-month-old needs to get in to see Lauren or an ENT or someone as soon as possible. Do you make sure they are nasal breathers before tape? Nope. We use tape to make people nasal breathers. I mean, we see so many people in our clinic that come in that they come in with their mouth wide open. And so taping 5 minutes during the day is a great start to that, you know? So we use tape as part of our breathing retraining. Can we use tape along with the Myofunctional appliance? Absolutely. I think you can pretty much use tape with just about everything. I mean, I wear an oral appliance at nighttime. You know, there you can use it with orthodontics. You can use it with a mandibular advancement device. You can use it with CPAP. I mean, there's really no kind of conditions or situations where you can't use a tape when you're doing something else for your treatment. You would agree, Lauren, right?
Yeah, I would agree.
Okay. Let's see, anything else? I think that is it. And that brings us right to 9 o'clock. This was great, Lauren. I really appreciate it.
Finished early.
Yeah, no, this was great. So thanks again, everybody. Hope you guys got a lot out of this. Again, like I said, stay tuned. Facebook, YouTube, stay on our email list. We're going to be sending out a lot more fun learning opportunities in the future, just like this. I'm sure we'll be featuring Lauren again. I'll be doing some other stuff as well. So stay tuned. Thank everybody for joining tonight, and have a good night. Take care, guys.